Hello everyone. Today we are going to discuss the very important disease of horse, that is equine influenza. Starting with the introduction, it is commonly called as horse flu. It is most economically important contagious respiratory disease of horse. It is highly contagious and spreads rapidly among live horses, and horses of 1 to 5 year old are most susceptible to the infection. The disease is caused by influenza virus A, which belongs to the orthomyxovirus family. It has further two types, influenza A equi-type 1 and influenza A equi-type 2 virus. If we talk about its epidemiology, the distinct influenza virus have been found in horse population worldwide except in Iceland and New Zealand. Influenza is rarely fatal except in donkeys, zebra and debilitated horses. The incubation period is 1 to 3 days and the disease was first recorded in India in 1987. If we can see its transmission, it mainly occurs by inhalation of respiratory secretions directly. The equine influenza affected horse, which sheds virus up to 10 days in nasal discharge, which can infect crowded housing practices in horse management. It also affects the unvaccinated animals as well as 1 to 5 year old equines. Dogs can also acquire infection by close proximity with affected horses and also by eating infected horse meat. When the equine influenza affected horse get transported through international trade, it can also lead to the transmission of the disease. If we can talk about its pathogenesis, primarily virus attached to the epithelial cells via hemagglutinin spikes and enters cell via endocytosis. Then virus replicates within respiratory epithelial cells and causes focal erosion of the respiratory epithelium. Erythema and edema of upper respiratory tract occurs. Then coughing develops early and persists for several weeks. Viremia is brief and mild, and at last deciliation causes secondary bacterial infection and complicate the condition further. The clinical signs observed in the equine influenza disease are the high fever, serous watery nasal discharge, submandibular lymphadenopathy, dry, harsh and non-productive coughing for 1 to 3 weeks. Depression and anorexia can be observed. Reluctance to move due to weakness. Death is also observed in young foals due to the pneumonia. The lesions observed are nasal discharge, which is scant and serous initially, but may become mucopurulent due to secondary bacterial infection. In the blood profile, we can see anemia, leukopenia and lymphopenia, monocytosis, increased neutrophil lymphocyte ratio. So for the diagnosis purpose of this disease, we can go with the clinical signs and history. Another one is the serological test. Complement fixation test can be used. The hemagglutination test can also be used for the diagnosis. And virus isolation in chick embryo can be done, as well as serum neutralization, ELISA, thoracic radiograph, identification of viral antigen by immunostaining, and the disease can be differentially diagnosed with equine herpes virus infection and equine viral arthritis. So if we can talk about the treatment, there is no specific treatment but supportive treatment with NSAIDs, antibiotics, rest and nursing can be given. The disease is controlled by isolation of newly introduced horse for 2 weeks. The hygienic management. Vaccination should be done with intranasal modified live influenza vaccine. Foals should be vaccinated with a single modified live intranasal vaccine or a series of 3 inactivated vaccines. Brood mares should be vaccinated 4 to 6 weeks before falling. Now here is the vaccination schedule, in which the first dose of the vaccine will be given at 6 months of age, and the first booster dose which is given at 3 to 6 weeks after the first dose, and the second booster dose is given between the 10 to 12 months of age of the horse. Thank you very much, and please do like, comment and subscribe.